I know your background, 30 years in the industry, MBE services to nursing, chief nurse of a big hospital trust. So you must probably have thousands of staff reporting into you, do you? Directly and indirectly.
Yeah, so we have over 3,500 nurses, midwives, allied health professionals, and people that work in the nursing family. So it's a big old job of leadership. I remember when I first qualified as a nurse back in 1996, in meeting the director of nursing and thinking, "Oh my goodness, what an incredible opportunity to lead people and to improve outcomes for patients." And 25 years later, kind of, I suppose, here we are. It's a huge responsibility, but one that I'm very honoured to do and love doing.
Yeah, so that leads me on to, what's a typical day at work for you? I know every day will be different, but can you give us a sense of a typical day?
Yeah, well, I guess the role of the chief nursing officer in most organisations, you need a sense of real kind of dexterity of leadership. So you need to be able to be competent around some of the operational issues that we get. So having too many patients and not enough beds is a frequent operational challenge that we have, right the way through to strategy. So a day can be mixed with spending some time in our emergency department or in our central delivery suite, making sure the team are okay, right the way through to spending time with the board and colleagues, thinking about strategy, thinking about the forward view, and essentially how we make care better for our patients and our communities. So it has a real variety, which is a thing that I personally love. That really does get me out of bed, and it really kind of intellectually challenges, which is the thing that I particularly enjoy. Most problems are complex and tricky and challenging, but with a great team, you can bounce ideas around and come up with interesting solutions.
Yeah, and the reason I invited you to do the forward was because from my network, when I reached out to ask for a chief nurse, literally I got the odd other chief nurse, but I got maybe half a dozen people saying Steve, Steve, Steve. So I thought I definitely need to try and track down Steve. I suspect that teamwork and that ethos and that cohesion is big part of you and how you run things, which probably makes the whole job more manageable.
Yeah, I'm very honoured, and I don't pay any of those people, so I'm very grateful. Look, I work with and have worked with some of the most incredible nurses, leaders, and others I could ever possibly imagine, and I'm hugely grateful for having had that opportunity. I think my career is also in part defined by working in some really difficult places. And I think about my first director of nursing role was probably the most challenging time I can think of in my career, even now. But looking back, it was the most wonderful, because it enabled me to flourish in my leadership. I learned how to do things that I never thought that I could do, and I was pushed in all sorts of ways. But principally, it was about being kind to other people and working alongside other people. So I think that has helped shape the leader I am today. And when you lead with a degree of humility and recognize you don't always get it right, in fact sometimes you can get it very wrong, that's important.
Yeah, absolutely. So what sort of daily hours do you work, and how do you manage that and avoid that overwhelm factor?
So I really struggle with this one. And actually the FitCare book has been really helpful in just helping me think about my own practice, but also thinking about overwhelm. So, most directors of nursing will do at least 10, 12 hours a day, if not more.
Yeah.
And we'll do them for most days. But that's part and parcel of the job. And there's always that little bit of a job description that says you'll need to do whatever is required to do in the time that you do or don't have available. So that's not an issue. These are big jobs. They are well-paid jobs.
Yeah.
And it's all right that there's high expectations for delivery. But in that, you also have to create some space for thinking time and for kind of rejuvenating and recovery. So there are times in my career, in fact, in times more recently, where it's felt quite overwhelming. And if I think about the nursing strikes, personally very committed to enabling people to have their voice, but the overwhelm came from the fear of the unknown. This was new territory for me. It was new territory for the team that I work alongside, and new territory for the profession. So there were times when it did feel quite overwhelming, but I'm really lucky. I work within a great executive team that's supportive, that understands, and gives the space for those overwhelmed moments when you just don't know which way to turn. And things like having a coach, and as I say, working with the team I've got gives me lots and lots of energy.
Yeah.
I've also got 2 dogs and a husband that keeps life busy, which is great.
Yeah, and support and love and all that side of it. Which sort of leads me on to, you mentioned early service in the conversation, and I'm pretty sure service is in your bio as well on LinkedIn. And is that, I'm guessing that must be part of the reason why you agreed to do this forward, because reading somebody else's book is not a time free exercise, and it requires quite a lot of effort. So why did you do it? Is it linked to you actually feel like you want to serve, and there's a purpose to doing this sort of work above and beyond 12-hour days?
Yeah. I mean, service is very important for me. I'm a public servant, and there's something in that word of service and servant to others. That's probably been ever since I was a kid. I mean, I was in the Red Cross as a 10-year-old in St John Ambulance, and my grandmother was a state enrolled nurse, and my mum is still a healthcare support worker. So service has been part of our family without question. But I think the reason for doing the book is the thing I love this profession, and it's an incredible profession. It's given me huge opportunity, and it has a huge impact in people's everyday lives. And the kind of cradle to the grave is perhaps a bit poetic now, but it truly does impact on everybody's lives. So the opportunity to think about how we care for one another, which is what Fit to Care essentially does, it gives us some of the tools and some of the opportunities for thinking about how we look after ourselves as an opportunity that I can't miss. And that's why I wrote the foreword, is because I could see the real value in having almost a toolkit by your side that will help to ensure that you look after yourself, but also be a great nurse.
Yeah, thanks again. I'm really honoured that you took the time to do it. And it's funny that you talk about a toolkit. I'm looking forward to actually getting a printed copy, because I've obviously got it on my desktop all the time, but I actually feel like I want it on the desk so I can just thumb through it, because there's quite a lot in it. So just picking up on the service bit, I feel really similar to you, even though I'm sort of a outside, self-employed, independent person.
Look, I did spend some time outside the NHS. In fact, I've done that twice, where I genuinely thought that I could make a difference from the outside. But in reality, growth and development change happens from within. One of the benefits of the role that I have means it has a degree of influence and power. And I recognize that what we really need to do is to ensure that everybody feels like they have that influence and power to make change. And actually we see small amounts of improvement. So if I think about the work that I've been involved with, and indeed many of my colleagues have been involved with in terms of quality improvement, that improvement starts by a seed of an idea in somebody's mind that says, I think we could do it better.
Mm.
But I think in reality, we need people both inside the organization and outside to make it even better than what it is.
Yeah.
So there were times when I was outside of the NHS, kind of almost pining to go back in. But there have been roles outside of the NHS where I have been able to make some change and some influence. The reality is, with an organisation the size of the NHS, it's going to need a collective mind of society and people in it, outside of it, to really help shape it for the future. And of course, we're at an interesting juncture of the NHS and society because of a change in government. So we're all waiting in anticipation about what that may or may not look like. But what we do know is it will be different.
Yeah.
And the NHS will go through its next phase of iteration, of improvement and change.
So you've got massive experience with the NHS and externally as well, which is good to hear. Given all that, what are the things that you took from the book that you thought, what are the key insights, I guess, that you took from it that you could possibly use and implement going forwards?
So I suppose the key insights for me, and again, if you look through the chapters of the book, what you do brilliantly in the first couple is help us understand the context within which the profession and we are operating, both kind of at a macro and a micro level. I'm personally really fascinated by the kind of cognitive behavioral stuff, how people think, why organizations do what they do. And I think the chapter in the book that deals with that specifically is really helpful. There's some interesting terms which are a bit more complex, and they're complex because I've never come across them.
Yeah.
But I think had I understood them previously, I'd understand how change works and why people behave in the way that they behave. So an introduction to those kind of terms is really helpful. And then clearly there's a whole toolkit in the final chapter, which is thinking about self-care, thinking about how you work within teams and within organizations. So it takes you on a real journey. And I think I've said it's sort of that journey of discovery, from where we are now, some of the real challenges, to actually what can I personally do to make this better, both for myself, but also for the people that I care for. So there are a number of takeaways that you can use and have, but also it's a fairly easy read. I'm not a great reader, interestingly, but it was an easy read.
That is so good to hear, because literally my life was transformed probably about 3 years ago when I was introduced to Professor John Vervaeke's work. He's done 50 hours, 50 lectures on awakening from the meaning crisis. And that's just opened my eyes to a whole new world of all this cognitive science, behavioral change work. And for me, the Eureka moment, I think, is historically, I think we all fall into the trap of, it's the manager's problem. The managers know nothing. And, aren't they idiots? Whereas when you start to understand those cognitive science behavioral traits that we've all got, you realize they're not idiots. They're just humans. And we're overwhelmed with stuff, and there's things we can do to help that and to bridge the gap between. My biggest drive, I think, at the moment is just bridging that gap between the managers at the top and the frontline staff. And that the knowledge on the front line is so critical, but nobody's got time to really, really connect with it. So that's really what I'm trying to do with a lot of the Fit to Care, and see that it is a personal mental health ability. When you feel well and you're healthy and you're fit, you can do a lot more and you can achieve a lot more. So that's part of it. But being fitting with yourself, fitting with your team, fitting with the organization, and ultimately serving the patient, life becomes a lot easier.
Yeah.
But it's hard to see all that.
And I think the important thing that the book really helped me understand was the role that I play in those complex systems and those complex behavioral kind of elements. So we should always start and finish with us in terms of ourselves. and what we believe and how we act and how we behave, and that invariably will decide on how others act and behave around us. And you're right that we are all in the NHS and in healthcare principally for the same reason, which is to serve and to ensure that the people that we care for get the best possible care. And the reality is that through overwhelm and other factors, sometimes the way that that's delivered is a bit clunky and a bit unhelpful, and is sometimes received by people in a very different way than that it would you desire to. I mean, I've generally never met a bad person in my entire nursing career, but I have met people, and I have probably done this myself, where either through a bad day or something going on contextually, that the way that they deliver a message or the way that they behave isn't normal for them, and then it's received in the wrong way, and then that grows a sense that this person doesn't listen, they don't behave well, and those kind of things. So it is complicated.
Yeah.
But people's sentiment is always, in my view, always the right one, which is, how do we do the right thing?
Yeah. I've got a Margaret Wheatley was a real eye-opener for me. I don't know if you've come across her, a management consultant, but really amazing at conveying that deep down humanity is where it's all from. And if you can get a team that really connects at that level, anything's possible. The things you can achieve is just incredible. You've got a unique meaning and purpose which transforms or transcends sort of the ego and all that conflict that you can have at an individual level of, well, I said this and you didn't listen. It's like everything becomes focused on the purpose, which in our case is the patient. And this sort of stuff, it's like you can open your eyes and see what the hell's going on. Maybe it's just a midlife crisis I'm having, but all this ties together for me in terms of meaning and service.
Yeah,
and through the dysfunctions when you look at it like this.
And there's another important word which I write in the forward, which is around belonging. So how do we belong with teams, and therefore when we increase that sense of belonging, actually my sense is teams work better together. And we see that particularly in colleagues in the global majority. So we've worked really hard in our organisation, and I know that many of us have, around how do we increase the sense of belonging, which is very difficult when you're going to another country with a different language and a different set of cultural norms. My sense is belonging will be one of the biggest challenges we have as we move forward, particularly in terms of how teams work well together.
Just a relaxed bit. I mean, it's all been relaxed, but I don't want this to be salesy in any way.
No.
I'm just really keen on picking your brains. I've mentioned it a little bit in the book, but not really. You mentioned earlier about thinking time, and this is a major thing for me. And the more you sort of start to look at these points, these particular issues, the more it becomes real and really massive issues. So the big one for me is meetings. Back to that, not really having the time or the resources to engage with the front line. I've got loads of stories where really bad things happen because very simple conversations didn't happen at the front line, and talking to patients and talking to those frontline junior nurses in many cases. And then when you look at that and you think, well, what is happening and why isn't that happening? And you get into the meeting structures and you look at meetings and you really study meetings, you see how unproductive most meetings are. And when you really look at it, and I've been looking at meetings for the last 12 months in terms of being in a meeting and thinking to myself, 80% of these people have not said a word. I can tell that 99% of them haven't really thought about these issues beforehand. They've not really thought about the agenda items beforehand. And then when you really study that, you realize that actually the outputs of these meetings, there's hardly any real value in them because we've not really tapped into the brains of all the people in the meeting. And then you realize actually the key people in the meeting aren't even in the meeting. The key people that we need are those nurses on the front line, are the patients and such like. So when you add all that together, you get a sense of we're not really thinking at all. We're probably getting 2% of our brain's capacity, our cumulative brain capacity. So how do we deal with that? So what I've been building this last 3 months in particular is this tool called Insight Genie. And it's because I've really got this last 9 months, I've really studied a lot and worked a lot with ChatGPT and AI. And it's all because getting that qualitative information is hard work. It's really hard.
Yeah.
But that's where the gold is. So if we can use AI to support that process, it means that people like you can really genuinely say to every frontline staff member, I really want to listen to you. It's not a back-end tick box exercise after the core team has decided what we're doing. It's at the start of the process. We will listen to you.
Yeah.
So, and that's making that super easy. So, and the plan for that is it's not another survey that everybody gets bored with. It's say, we will reduce the amount of meetings you have to go to. We'll reduce the time you've got to spend in meetings, because what we want is halving the meeting time, but doubling the thinking time. So we want you to spend 10 minutes in a dark room where you go, what is this problem? Or from my perspective, the problem is, and from my perspective, the solution is, and these are the things that I need to know that I don't know that you might need to know as well. So 3 questions. But because it's qualitative and you really value and you can genuinely go, we want your brain power.
Yeah.
It's a different world from here's a survey to tick. We transform stuff and just do it really easily. So it's for you, it would be, I've got a problem, write the context of the problem and then send it to the key people you need to engage with it, and it's job done. And then within a day or 2, you've got a report back. And what I'm finding is you just always get insights that you just never even thought about. So it's like I expected that. Oh, that's interesting. Never even thought about that. Never even thought about it. And that's the difference between a Deloitte business case that gets fired off for wound care that then costs £1 million in a pilot that doesn't work. You can find out why it's not going to work, within the first couple of days. So that's my vision for kickstarting the book, actually, is something that we can practically do really easily, really cheaply, has a high impact, and then can start us on this journey of looking into stuff a bit more detail.
You don't mention it in the book, do you? I mean, you've got meetings in there, but have you got?
Yeah, it's just a little mention of the tool to help with meetings, but it's not. I don't want it to be a big salesy thing.
The issue around, I suppose there are 2 things to me. One is that there are meetings for assurance, and whether we like it or not, we have to evidence we've gone through a process, and key people have to be in those meetings. And you're right. Many will often feel disengaged, and with the advent of digital meetings, I would probably say that 90% of people aren't engaged in the meeting. They're either doing something else, or their camera's off, or they're doing something else. But there is what you describe about the space that we need to create and have digital means to do that, where we can think. And if there was one thing that I would like more of, is the time to think. And it's interesting, isn't it? So when I worked in the university sector, I was the head of the School of Nursing Midwifery for a little while. There was so much time to think, and think with academics and professors and people in the profession. It was just so nourishing. Soul, because you had that time to think. The real challenge, though, is that you had so much time to think, but you had none of the levers to pull in order to be able to deliver the change. So we've got to get better as leaders in having time and creating the space to think outside of the normal assurance mechanisms that we have to provide ourselves and others assurance that we're doing what we need to do. And it's interesting, shared professional decision making, which actually is an American term used in the magnet journey and the pathway to excellence journey that a lot of American hospitals now use, and increasingly across the globe. So shared professional decision making is one of those options where you invert the kind of traditional leadership triangle, and you put the direct care colleagues at the top, and they actually lead the meetings. They help shape the agenda. So you get the real essence of the voice that
Yeah.
people.
Yeah, that's really interesting. I hadn't really studied that, but it's really in line with my thinking on the Insight Genie work, which is start with the front line and then use that report to structure the agenda.
Yeah,
and
absolutely.
hopefully what we can do is sort of manage by exception. So rather than trying to sound out everybody, sequentially for everybody that's in the meeting, we've already got 90% agreement on 90% of the things, and then we can sort of debate in detail the things that people are struggling with.
Yeah, absolutely. Yeah.
All right, thanks a lot. Really
All right.
appreciate it. See you
Take
soon.
care.
Bye.
Bye.